Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Staff Nurse Previous Year Question Paper Part 5. Let's start. When serum bilirubin level rises on third and fourth day after birth of the baby due to inefficient hepatic function is known as option A. Pathological jaundice, option B. Obstructive jaundice, option C. Physiological jaundice, option D. Viral hepatitis. The correct option is option C. Physiological jaundice. Identify the given image below. Option A. Tinea corporis. Option B. Bed sore. Option C. Steam burn. Option D. Flame burn. The correct option is option A. Tinea corporis. Which of the following drug is prescribed to an antenatal mother for fetal lung maturation? Option A. Bromocriptine. Option B. Metoprolol. Option C. Betamethasone. Option D. Metoclopramide. The correct option is option C. Betamethasone. Which of the following medication is administered sublingually for managing angina pectoris? Option A. Aspirin. Option B. Betalol. Option C. Nitroglycerin. Option D. Warfarin. The correct option is option C. Nitroglycerin. The reference point for the measurement of JVP is the option A. Suprasternal notch, option B. Sternum angle, option C. Belly button, option D. Nipple. The correct option is option B. Sternum angle. If a nurse evaluates the ECG and sees a sawtooth P wave, what will be the diagnosis then? Option A. Atrial flutter. Option B. Premature junction complications. Option C. Atrial fibrillation. Option D. Nasal arrhythmias. The correct option is option A. Atrial flutter. Non-stress test is said to be normal if there are option A. 2 or more FHR acceleration during a 20-minute period. Option B. 2 or more FHR accelerations in a 40-minute period. Option C. No declarations during a 40-minute observation. Option D. No acceleration during a 40-minute observation. The correct option is option A. 2 or more FHR acceleration during a 20-minute period. Apical pulse can be assessed at option A. At second intercostal space in the left midclavicular line. Option B. Between second and third intercostal space in the left midclavicular line. Option C. Between fourth and fifth intercostal space in the left midclavicular line. Option D. Between fifth and sixth intercostal space in the left midclavicular line. The correct option is option D. Between fifth and sixth intercostal space in the left midclavicular line. What should be the ideal ratio of cardiac compression and respiration during CPR in a child? Option A. 3:1. Option B. 15:2. Option C. 5:1. Option D. 1:1. The correct option is option C. 5:1. Which of the following is not included in the surgical safety checklist? Option A. Verify with patient name and procedure to be done. Option B. Allergy check. Option C. Medications check. Option D. Counseling. The correct option is option D. Counseling. What is the name of the outer lip-like structure that protects the entrance to the female reproductive system? Option A. Hymen. Option B. Labia. Option C. Cervix. Option D. None of the above. The correct option is option B. Labia. Which solution should be used to mop up the split blood on the floor of operation theatre? Option A. Sidex. Option B. Sodium hypochlorite. Option C. Savlon. Option D. Formalin. The correct option is option B, sodium hypochlorite. Identify the post-renal cause of acute renal failure. Option A, benign prostatic hyperplasia. Option B, acute glomerulonephritis. Option C, heart failure. Option D, anti-hypersensitive medication. The correct option is option A, benign prostatic hyperplasia. The reason of polyuria is best defined as option A, lack of urine formation. Option B, diminished ability of the kidneys to concentrate the urine. Option C, passing too much urine at night. Option D, dark colored urine. The correct option is option B, diminished ability of the kidney to concentrate the urine. ECG given below is of option A, atrial fibrillation. Option C, atrial flutter. Option C, sinus tachycardia. Option D, PSVT. The correct option is option A, atrial fibrillation. Most common symptom of alcohol withdrawal is option A, rhinorrhea. Option B, body ache. Option C, tremor. Option D, diarrhea. The correct option is option C, tremor. Weber test is done to diagnose option A, eye problem. Option B, hearing loss. Option C, respiratory problem. Option D, cardiac problem. The correct option is option B, hearing loss. What is mandatory before glucose tolerance test? Option A, NBM 8 to 10 hours prior to test. Option B, rich carbohydrate diet from 2 to 3 days before test. Option C, stop giving medication. Option D, no need to change. The correct option is option A, NBM 8 to 10 hours prior to test. Hand rubbing time for alcohol-based hand washing is option A, 10 to 15 seconds. Option B, 15 to 30 seconds. Option C, 30 to 45 seconds. Option D, 60 seconds. The correct option is option B, 15 to 30 seconds. Gastric lavage is a procedure done to wash or irrigate the option A, stomach. Option B, urinary bladder. Option C, rectum. Option D, urethra. The correct option is option A, stomach. Please like and subscribe. Thank you.